Good morning, everybody. Good morning, everybody. We'll just wait a few moments to get started. Good morning, there's people joining us. Lovely to see you. So we'll get started and hopefully you can all hear and see me okay. If you could pop a comment in just to let me know everything's working, that would be great. My name's Lauren. I am the team lead for the Sedgemoor Village Agents. You probably already know that by now. How long have we been doing these? It feels like a long time. Probably a good 6 months now, so you will have seen my face a lot. Morning, Carolyn, you can hear me. That's great. Thank you. So as I said, my name's Lauren. I'm the team lead for the Sedgemoor Village Agents. Weather's a bit better than it was the last time I was here last week. It's looking a bit grey though. Morning, Anne. Lovely to have you with me this morning. So if it goes to plan, I am going to be joined by Dr. Joey McHugh this morning. Dr. Joey McHugh is a clinical director at Axbridge and Wedmore Medical Practice. And Dr. Joey McHugh is going to join us and talk to us about a variety of things, really. Dr. Joey McHugh had another meeting before this, which she did fear might overrun a little bit. And she hasn't joined me yet this morning, so I'll just talk whatever I can talk to you about until hopefully Dr. Joey McHugh will join us. I will just keep an eye on my emails just in case she's having difficulty getting in. But fingers crossed, like she said, her meeting's just overrun a little bit and she will be with us as soon as possible. So what should we talk about whilst we're waiting? We've got 4 of you here this morning, so let me know how you are. How's your week been? We had a bank holiday weekend, so for lots of us, we've had a short week. Bank holiday Monday, last of the bank holidays before December, Christmas time's creeping up. Did you have a nice weekend? We were quite lucky with the weather, weren't we? It wasn't too bad. Have we got anybody watching who has had children return back to school this week, or are your children going back next week? How are you feeling about it all? Let me know in the comments if you do have children going back to school. I know Carolyn, who is watching with me and her are both quite looking forward to it. But we've been working from home for the last 6 months, the children home with us, which has been incredibly difficult. All children and parents are still alive, and we think that's an achievement, and everybody's well. But we are looking forward to them going back to school. What about anybody else watching? Have you got children going back? I suppose I could just chat to you a little bit about Sedgemoor and what we're up to whilst we're waiting for the doctor. So we are still very busy in Sedgemoor. The village agents are still getting lots of referrals from people who are looking for support. The types of referrals that we've been getting have definitely changed from, during the pandemic. The requests that were coming in were kind of urgent. They were either looking for support getting their medicines or getting food. It was kind of those one issue referrals. We were able to provide a solution very quickly. And then I would say over the last couple of months, things are kind of returning to a state of normality with our referrals. So they're becoming quite complex and there's lots of issues involved. All the kind of social issues that come up a lot for people. So isolation, loneliness, poor mental health, financial hardship, all those sorts of things. We're still getting lots of referrals for. So our agents are still working very hard across the whole of Somerset. But I can only speak for Sedgemoor as that is my locality. Our agents are still responding digitally. So we are trying to provide a solution to you over the phone or through a digital means because of the restrictions that are still in place due to COVID. We are trying to stay digital first as much as possible to keep us safe and to keep the public safe. The clients that we would normally be visiting are naturally quite vulnerable, and it wouldn't be the right time for us to go back in and do home visits. So provided it's not an urgent emergency situation, we are still responding digitally and have supported so many more clients than we would have been able to had we not have taken that digital response. So I'm just going to go over and have a look at the comments. Yeah, Carolyn says her children are back in on Monday, and they are feeling naturally quite anxious about it. It's been such a long time. 6 months is huge, especially in a child's life. So they are worried about whether they did enough work during lockdown. They are worried whether their teachers may be cross with them. Of course they won't, but it doesn't stop the worry. It is so difficult, isn't it? My daughter is going back into year 6, and she knows that that's SAT's year. She saw the year 6s before her go through it, and she's quite worried about that because she, as you said, Carolyn, she's perhaps worried that she hasn't done enough work to be ready to do her SATs. So, but I'm just hoping, putting all my faith in very good teachers, that they will handle the situation as well as possible and get the children back on track. Naturally, like you said there, Carolyn, the children are going to be anxious. All we can do is be there for them. You know, they're going to be tired, aren't they? That's another thing that I find after the summer holidays, is that first couple of weeks back is exhausting for them, let alone having had 6 months off. They are going to be really tired going back, aren't they? It's going to take a lot out of them, having to listen to new rules and abide by them and stay in their bubbles and all that sort of stuff. I think it's going to be really quite taxing on them. So I'm expecting perhaps a little bit of a dip in, or an increase in challenging behaviour, perhaps whilst they find their feet back at school. So if anybody else has had children back the last couple of days, have you noticed any difficulties? How's it been? So we have had a hello from Elaine. Hello, Elaine. I wonder, Elaine, if I can quickly, whilst I'm chatting away, I am going to try and find your email about pharmacy services at Superdrug, because that would be a really good opportunity to let people know. Whilst we're waiting for Dr. Joey McHugh to join us, I will talk to you a little bit about what Elaine has sent me. So Elaine is a driver for Bridgewater Superdrug, and she has kindly got in touch with me to let me know that they have a new manager called Jonathan Wood, and he's really interested in developing a range of services for Sedgemoor. And Elaine has given me a little bit of information about what those services entail. So they are doing free flu inoculation for eligible customers and a walk-in service starting in mid-September. She has also said there is a limited option of home visits for the housebound. So if you are someone perhaps who is caring for or are cared for, and you can't get out and about into the towns quite so easily, I would suggest you give Superdrug Bridgewater a ring, and they can let you know what they can do to help. They also have antibiotic cover for 3 days for urine infections. So that's really interesting. I didn't know that. So if you are someone who is struggling with symptoms of a urine infection and perhaps can't get into the doctor's surgery immediately, perhaps go and speak to your pharmacist and see if they can help. They also do free health checks and medication reviews, and also a downloadable prescription order app to speed up requests. So that's really interesting. If you have anything that the pharmacy Bridgewater Superdrug could help with, then please do give them a ring. Their pharmacy number is 01278 423 055. Perhaps, Elaine, if you're still watching, you could pop that in the comments for me so that people there, you've done it already. Thank you very much, Elaine. So Dr. Joey McHugh is with us. So I'm going to add her into the stream now, and she can talk to us a little bit about her role in the community. Hi, Joey.
Hi, sorry, I'm a little bit late.
That's okay. I did explain that you had a meeting beforehand, and I've just chatted away whilst I've been waiting. So how are you? I'll let you introduce yourself, if that's okay.
So my name's Joey, and I am a GP in Axbridge and Wedmore medical practice, where I work 3 days a week. And then on the other 2 days, have a role as the clinical director for the North Sedgemoor Primary Care Network. So that role is about how do we make healthcare make more sense, and how do we just join things up in a much more effective way.
Yeah, fantastic. So where should we start? It's been, I imagine, a busy 6 months for you. Can you tell us a little bit about how things have been for GPs in the last 6 months? What have been the changes and all that stuff?
So the past 6 months have been hard, but they have been an opportunity to see it really our community at its best. and it's been an opportunity for people from health and social care to start challenging the ways that we have historically worked, so that they make sense for the future. So what we've seen in day-to-day primary care is that we are doing more online consultations, we're doing more video consultations, we're doing more on the phone. We are still seeing people, so that's why I've got my scrubs on today, because I'm in the middle of a normal surgery, but wherever possible, we are doing things over the phone. But that's not to say that if you need to be seen, you'll be seen, either in the surgery or at home. But we're just trying to make sure that we keep everybody as safe as we can, really. So that's been interesting. Wearing PPE is interesting, although thankfully it's a little bit cooler now, so not quite so sweaty in my mask and my visor and my apron. But that was a bit unpleasant.
Weather, won't you? Yeah.
Although now it's humid today, my glasses keep steaming up again. So, you know, I'm just being fussy, really.
Yeah, can't win with PPE.
And then one of the other things, and I guess the main exciting thing for me has been that we've formed this really good team with all of the community services, with the village agents, with adult social care, with the pharmacies, the district nurses. So we meet every day now for 45 minutes to discuss cases and discuss people and families who are involved with all of us. And one of the things that we've discovered is that actually, if you're known to one person, you're actually probably known to 10 groups. And it's about how do we connect that information so that people are only having to tell their story once and that things are making sense. And it's early days, so we've only been doing that for 5 months now, but it's been really successful, and really we've really seen that care has improved. Obviously it means that sometimes you won't necessarily see the doctor as often as you would have done, but it's not that we're not still following things through. It's just that actually it might be more helpful to see the district nurse, and then the district nurse feedback about what a wound looks like, or to speak to the pharmacist about a rash, and then the pharmacist feeds back into us. So that's been really positive. Ridiculously, I think that people thought that we were having those conversations already, but actually that's hugely new for us.
Yes.
It's good.
It is good. And I know for our agents who attend those meetings, it's been hugely beneficial, because you have that multidisciplinary approach, all those professionals sat around the table. We are able to get that support for our clients there and then, information share, work with other professionals. Interestingly, Kim's just joined us, and she has said absolutely the one team is invaluable to us as village agents, and it really has improved the outcomes for the people that we work with. Definitely.
I think the other thing that it's done is that it's highlighted that we are all in this together, and what happens in my surgery has a down the line for somebody else, and so it's about us working together. And I think it's helped us remember that we're all people and we've all got needs. And now I know more about Kim, and Kim knows more about me as an individual, and I think that brings a richer experience for patients and for just coming to work, really.
Definitely, absolutely. So, yeah, absolutely. We can't agree more. It's been really successful, really great for our agents to be really integrated into all services. So that's been great. So shall we? You kind of touched on it, but shall we, for the people watching, perhaps talk about what the process is at the moment? If someone is worried about their health, what's kind of the process that they need to take, the first kind of steps? What will happen when they perhaps ring the doctors?
So in my surgery, what happens is you can access us through either phoning in the traditional way and speaking to one of the receptionists, or you can go online and fill out an online consultation. And so if we talk about the telephone process to start off with,
great.
So the receptionists have now got plenty of time to make sure that they're getting all of the details from you that I could possibly need to make an assessment about when do you need to be seen and who do you need to be seen by. So they take all of those information, feed it back to me, and then we decide together who is the most appropriate person in the team to pick up the phone and make that call. Either it's, I'm going to book you in to see a nurse, healthcare assistant, I'm going to book you an appointment with the doctor to see the doctor face to face or over the phone, or I'm going to put you in contact with the musculoskeletal practitioner. Or it can be actually you need to go to the village agents, or you need to go to the pharmacy. We still do an emergency day as we did before, so that really is exactly the same as it was before. With the online consultations, so we've seen a huge increase in the number of people submitting online consultations, and they're so good. They're so helpful, and I know as somebody that's filled it out from the other side, does feel really a little bit laborious to tick through some of these boxes, but actually these are questions that are really important to help us offer the best care that we can. And there's lots of safety nets in, and we look at them within the next day and get back to you by the end of the next working day. So actually you're getting a really rapid response. That in honesty was probably better than before COVID happened.
Do you think it's enabled you to see more people than you would have done if you were doing face-to-face?
Yes, without a shadow of a doubt. And I think because everything takes so much longer now. So if I bring somebody in, I clean my room beforehand, I then put on my PPE, then I get you in, and then I have to do that whole thing again. It takes so long, and that's not to say that we're not doing it, because we are, but we've managed to add in probably an extra third of what we would do every day, which means that people aren't waiting as long as they were before, and that we're able to offer just a more responsive and effective solution, really. So it's.
I guess there might be people thinking, perhaps the elderly cohort of patients wouldn't have access to that service, but you could always ask friends and families to support you with that online consultation. If you've got a neighbour perhaps who might be able to support you online and do the form filling for you, that could be an option, couldn't it? To get
it could, but that's not to say that that's the only way in that you can still pick up the phone and talk to us. And we've still got the same number of receptionists here. We're still functioning from that element as normal. The only thing that we're asking is that people just don't walk into the surgery, and part of that is just a safety thing, but also it's about everybody's time is precious. And so actually, if you can just phone me and say, I need a prescription, or I need some hearing aid batteries, we can sort that out.
Yeah, fantastic. For those people that are going to come into the surgery and perhaps don't know, are they do they have to wear a face covering or any other PPE? What are you asking of them visitors?
So we are asking for face covering only. What happens is we ask you not to turn up too early for your appointment. We keep the number of people in the surgery to a minimum to make sure that we're able to do social distancing. we will call you in. We check your temperature and go through all of the traditional now routine COVID questions that we ask. We'll ask about, have you had a temperature at home? Have you had a new and continuous cough? Have you had loss of sense of taste and smell? And then we'll ask you to use some alcohol hand gel on the wall, and then we'll bring you through to our room. In summer, we were asking people not to bring in lots of coats and bags and jackets and things like that. Obviously, now that it's raining, that's a little bit more difficult. But we're just trying to keep things as clean and as safe as we can. Obviously, if there's a reason why you can't wear a face mask, then that's completely understandable. And we are wearing PPE ourselves, so that's okay. And then everything in the surgery works in a one-way system so that people can come in and then not have to worry about the social distancing. So it just flows out the door. And then there's some alcohol hand gel before you leave, and then that's it. But there's no rush. There's everything is a little bit slower so that everybody
has time to
and feels. Because everything's hard, like rubbing alcohol hand gel in takes time, and we don't want people to feel stressed about
rushed. Yeah, all of those things.
So, and yeah, we're just going really slowly.
Good. So on that note, on that stress note, we've had a question from somebody watching. They've said, Joey, would you say mental health has suffered recently? What's your experience of mental health during the pandemic? Has it been worse for people?
So on the ground, we have a huge worry about loneliness and the impact that lockdown has had on people's social networks and how that's impacted on people's well-being.
Yeah.
And so having this talking cafe online is a huge benefit, and having this ticking over, I think, is something that is really valuable for people to join. So I think that we found that loneliness has started to be something, and very much as a surgery, we've tried to ring people that we knew were on their own, or that we were concerned about through our health coaches. Yeah. I also think the stress of for people with children at home with their children was hugely demanding. Yeah. Yes, it was. And I think that I'm hoping that the schools going back will just help with a bit of routine and just give people, we all love our children, let's not get that wrong, but having that opportunity to get back to school is important.
Just a bit of normality, isn't it? A bit of, like you say, routine, a bit of structure. Yeah. I do think it will add another set of worries, perhaps. There's always that fear of, will the school be shut down again, or will my child get unwell? But I think as parents, having a little bit of time to ourselves, whether that even be working, just that kind of normal time, I do think will hopefully improve the mental health of those that have struggled in that way.
And very much we've been linking with the team called the Transformation Team, who have been providing support and signposting to resources for people with any type of mental health issue or any type of dip in their well-being, and that has been a really helpful resource that we've had. But again, what we've been trying, or what I've been trying to communicate, is that some of how we are feeling is okay. It would be weird for us not to be feeling this way, and it's about acknowledging it and then seeing how much is within our control, but also how much do we need to go to other services. So how much do primary care and GPs need to be involved? How much do actually linking up with other people. How can we facilitate that happening? How can we do social distance walks? How can we do and things like that?
Yeah, so perhaps if you know that you've been feeling quite low in mood, and the things that would normally bring you pleasure, normally bring you joy, if that's not happening, if you're not improving your mood at any time throughout the day, that might be the time to come and say to your GP, I'm struggling. It's become more than the norm.
And just give us a ring, because actually that first call is that's the first step, and it's such a massive thing, but actually the benefit of making that call is so huge. And it might not, it's not going to necessarily be a simple, well, here, have a prescription, off you go. It's more a sort of, let's look at everything together and how we can optimize every little bit, the long run, really.
In your dealing with the mental health, you use the online service to get support from you. Oh, there's a child there, talking of children. Can they access the online service?
Yes, so the online service will go through some questions. It will also provide you with some resources to have a look at, and one of the things to also draw attention to is that the talking therapies through Somerset Foundation Trust is a self-referral. So if you feel that actually talking about how you're feeling and getting some strategies for that, you can access it online for that.
Someone in the comments has put, would you encourage mindfulness activities? And I imagine so.
Yes. So
self-help things.
Yeah, so I'm a massive mindfulness advocate, but in a way that makes sense in the real world. So thinking about things that you do every day that you can turn into a mindful process. So for me, it is the loading and unloading of my dishwasher and walking up and down the stairs, focusing on holding the banister, and just giving myself just a little bit of time to be present and not be thinking about the 101 things that I still need to do that day. But if those things aren't working and you still feel like you need extra support, I just need you to ring me and speak to one of my team.
Absolutely. Great. And so I think another topic that we were going to move on to, somebody's actually asked about, so they have said, do you think more people are fearful of the common cold now as the autumn colds are starting to kick off? And that kind of rolls into the flu season that we were going to kind of touch on.
Yeah.
So are people scared of the common cold?
I think it's so difficult because actually so much of the symptoms cross over. So the temperature, the cough, the feeling really quite grotty could all be common cold, or it could all be COVID. And so what at the surgery we've been encouraging people to do is make sure that if they tick any of the boxes for a potential COVID infection, that they are getting tested as soon as appropriate, so that you are isolating properly and so that you know where you stand. This is particularly important for children, so particularly with children going back to school, we just need to be mindful of that. Again, we're more than happy to just talk things through over the phone or to go through the online system so that you can get the advice and be directed to the right place. But I guess what we're really hopeful for is that one of the lessons I think we've all learned is about the importance of having a well-stocked medicine cabinet, so that actually if you have symptoms of a cold, that you're doing loads of the self-help and the self-care stuff that we need you to do. So taking paracetamol, making sure that you're drinking plenty, and isolating if appropriate. But at the same time, we don't want everybody to go back to isolating if they don't need to.
Absolutely. I think that's the kind of advice coming back from schools as well, isn't it? If there's a sign of a common cold, or COVID, that we bring the children home and isolate them until they've been tested, and then we can rule out either or. So I do think that perhaps we'll have improved absence rates in schools with lots of common colds coming up, but I think that's the right way to do it, to stop the spread, because that one time that we don't isolate, and if it is, it's going to be difficult. So talking about flu season, flu inoculations, are we still doing them this year? Are we still advising people have flu jabs?
So after this meeting, I've got another flu conversation with my practice about how we can really vaccinate as many people as possible. So in the next, we start at the end of September, so we start our flu programme then as soon as our flu vaccines arrive. As per the guidance from NHS England and the government, we are focusing on people over the age of 65 and those who are under 65 who have a long-term medical condition that requires a flu vaccination. And again, everything will be done with wearing PPE, everything will be done in a socially distanced way. So that traditional flu clinic that people were very used to isn't going to be the same anymore. It will be much calmer. It will be much more orderly, and there will be lots more support and guidance around how to be at the flu clinic. With regard to the numbers that we're trying to vaccinate, so we're trying to vaccinate over 75% of the population who fall into those risk categories, and the sooner that you can get your flu vaccine, the better. So it's a big push in the first couple of weeks, and then there will be lots of opportunities for catch up, so that we are achieving the number that we need to achieve, and that is going to be really important. When we get more information about the reduction in the age band, so when we start looking at the over 50s, then that will probably be done again in a similar way, but at this moment in time we don't have that information from the government, so we're just holding fire and just focusing on the target population to start off with, and then we'll go to the second group, but over 75% is what we're aiming for.
Fantastic. Fingers crossed we get it. I think the last thing we need this year is flu becoming a big issue for people as well as everything else.
And I think it's also an opportunity for us so we will be giving pneumonia jabs at the same time if people need, also giving shingles at the same time, so not having to come back to the surgery multiple times in the winter.
And also, I guess it gives you an eyes on opportunities for some people that might not have seen a doctor or a nurse for the last 6 months. They may have stayed quite secluded, and you may not have had the opportunity to pick up on a deterioration perhaps with someone over the age of 75. So
definitely. And I think it's also an opportunity for people to see how the surgery works, and how safe it feels. I know that we all feel really safe here, and I just want people to know that they can turn up to surgeries, or that if they've got an appointment, then it's different, but it's safe.
Absolutely. So if anybody else watching has got any other questions they want to ask Joey, then please pop them in the comments. Someone has asked, going kind of back onto the mental health topic, Deb's watching, and she says that she's found that she's struggling with working from home and then being able to switch off. She says it's all too accessible. So are there any tips to cope with this? And lots of people have kindly given us some tips in the comment section. This is something that I struggle with because we've suddenly been working from home a lot, and I find that putting my phone and my laptop away really helps. I find that if my work phone's lying around, it's too tempting to pick it up in the evening and check if anything's come through. And so actually physically creating a space that is separate from your home space really helps me. But is there anything, Joey, that you would suggest for someone struggling to switch off?
So on my other 2 days, I also work from home. And so what I do is I still do a little commute. So I take a little lap around my village with a coffee, and just not pretend to be walking to work, but just getting myself in the mindset that today, now this is going to be my work time. I give myself a lunch break, that I, again, turn everything off. And then at the end of the day, similarly to you, I put all of my work stuff into a box and shut the box, and then do a little commute around the village again, and then have to be really disciplined about what I'm doing in the evening. I listened to a really good podcast that's called Slow Mo with Mal Gaudat the other day about the importance of active rest. And he was very clear about the importance of scheduling an activity at the end of a workday to take your mind away from it. Okay. So I would definitely recommend that as a technique. The other thing is to make sure that you're talking to your employer, and if things are actually really difficult, to discuss going back into the office for a couple of days, or a day a week, but also to talk to the occupational health people at work about solutions that they will have, because this is new for us all. So yeah, I would definitely encourage that.
Yeah. It's been a long 6 months for people, especially those people working from home and have had massive changes. I know that I really encourage my team to take their annual leave and to make sure they've got planned, scheduled time off, because it all becomes too easy to just roll time into one, and suddenly you realise you're exhausted. So yeah, lots of great. What was the podcast again, Joey? Someone's asked.
It's called Slow Mo. So it's SLO -MO, and it's with Mal Gaudat, who wrote a book about solving for happy, and it's very good. It's very good.
I think I'm
going to have to go.
Yes, no worries at all, Joey. It's been great to have you. Thank you so much for joining.
For inviting me.
We have contact every day, so if anybody has got any further questions that come up later, then perhaps send a message in and I can ask you, Joey, at a later date.
Yeah,
but thank you so much for joining us. It's been great to have you. Bye,
See you soon. Bye.
So Joey's gone. She's obviously a busy practicing doctor. She is in the middle of a surgery today. So she popped off, finished her day off. But if there are any further questions that you want to put in the comments, or as I say, please pop a comment perhaps later, send us a message if there's anything that comes up for you. If you're watching this in replay and there is something that you want to ask the doctor, we do have contact with Dr. Joey McHugh and lots of the other doctors in the North Sedgemoor and the Bridgewater area pretty much every day at the moment. So if you are concerned, if you are struggling to access your healthcare services, if you're worried about accessing them, please do let us know. The village agents can perhaps give you a ring, give you some reassurance, talk to you about the new processes that are in place in surgeries, and make sure that you get the help that you need. Whether that be a physical condition or your mental health, then please do know that doctors, healthcare professionals, the village agents, we're all still working to support you with those. It's not all about COVID. It is all of those things that would have come up to, before the pandemic. So please don't suffer in silence. Please do let somebody know that you need help, and we'll all be there for you. So there's some really great comments. Thank you all for engaging and giving people lots of ideas about how to perhaps look after our mental health and reduce our stress. I think it's perhaps shown that this is a conversation that needs to be spoken about more. And actually next Friday, if you were to join, I'm shifting days, so I'm doing the Friday and I am talking about mental health. I'm going to be talking about how we can shift ourselves out of perhaps some of the negative habits that we've picked up during lockdown, whether that be, we've gotten used to the stress and we're in this constant stressed state, whether it be we're using unhelpful substances or unhelpful coping mechanisms to reduce our stress. I'm just going to be exploring some of those things. So if mental health is something that you have found difficult and you are perhaps still struggling with, please do let me know what you would like me to discuss. Send in some questions. Join me next Friday at 11 o'clock, and we will be delving into all things mental health. How can we, for the second half of this year, up until Christmas, maybe, we've sometimes September for a lot of people feels like the start of a new year because it's the new school year, and it's another chance to kind of refresh. Let's look at what's happened in the year so far and get back on track for the rest of the year till December. So as I say, next Friday, 11 o'clock, please do join me, and we will talk all things mental health, stress, relaxation, meditation, mindfulness, all that sort of stuff. But if there are no more questions or comments today, I will say goodbye, and I will see you next week. Thank you so much for joining me this morning. If you do watch this on replay and you have any questions you would like to ask, please let us know. And as always, if you are struggling with anything, please do pick up the phone and ring us. Contact your local CCS agent on 01823 331 222, or you can go to our website, www.somersetagents.org.uk. Let us know that you need something, and we will do our best to help you. It's been great to chat this morning. Thanks all. Take care.